Okay, we are going to go over your lower back and core rehabilitation assignment. So I have posted the PowerPoint that I'm going to use, but I am going to go through it just briefly, kind of explain it to you, let you know how you need to look at it, and then the specifics of the actual assignment. So for this assignment, I want you to design a rehabilitation program for a lower back core injury. Okay, so you'll notice up at the top here I have, as a student athletic training intern, you are asked to assist in designing a program for an athlete with lower back pain. Okay, so this is just some non-specific lower back pain. Okay, you're gonna probably come in contact with a lot of these people in your future careers. Lower back pain, LBP, is fairly common in the general population, and then as well as the active population as well. So to design a rehabilitation program, this is part of your plan of action of your SOAP note. When you want to get detailed with it, the first two things that you need to list in your plan are your short-term goals and your long-term goals. And we're going to go over the specifics of those in just a second. But you are going to need to list the goal and then explain why the goal is important. Okay, I need you to do both of those in order to get the credit. Same thing for the long-term goals, except there are 3. And then after that, we're going to get into 2 rehabilitation stretches and then 3 rehabilitation exercises. Okay, and for those, you're going to give me the name, give me clear instructions, and then give me a length of time or a set rep count. Okay, so your stretches, you're going to have definitely a length of time held. You'll also have a set rep count potentially. For your exercises though, those are more active, so you may not really have a length of time held here. Okay, so you may only have a set rep count that you need to list. So this is the assignment. You were provided this in class, so hopefully you got it. Alright, so if we flip over to PowerPoint here, let me make the screen a little bit bigger for you guys. And I'm going to leave it in the split screen here because there are some important notes down here at the bottom that you need to look at. So when we look at this lecture, 3 main aspects: short-term goals, long-term goals, and then the actual rehabilitation exercises. So your short-term goals are the things that you need to do in a very acute setting. Okay, so right then and there, the next 2 to 3 days, you've really got to get on this. So the first and foremost one is you decrease the patient's pain and inflammation. If you have an athlete in pain, especially with low back pain, they're not going to want to do anything. So there are some different techniques that you will use throughout the therapeutic process just to break that pain cycle, get them out of pain, so that you can then start to do some of the other active things as far as your stretches and your exercises, which those are important to get started early on because they're not going to start to get better until you get them out of pain, okay? And they're not going to start to get better until you actually do start doing those exercises. The second goal is you want to go ahead and start a flexibility training or a core strengthening program. And that's just to get started. You want to get on it just as soon as you can. Looking at your long-term goals, and these kind of go with all injury rehabilitation programs. Okay, your long-term goals are always going to be teach proper form, because a lot of times the reason they're injured is because their biomechanics are incorrect or they're doing a skill incorrectly. So we need to make sure we are teaching proper form so that you prevent those future occurrences. Along with that, you do want to prevent reoccurrence. So just making sure they are fit within that skill, they are appropriately doing that skill, and that just needs to constantly be a long-term goal, is to prevent reoccurrence. And then return them to play at baseline or better. Okay, you never want to send an athlete into play when they're only 70% back to their normal status. You send them in at 70%, now that 70% is their ceiling, and they're never going to be as efficient of an athlete as they were before the injury. So you want them to return at their baseline or better. So when I take you through this rehab protocol here, I'm going to take you through some stretches, some range of motion, and then some strength exercises. Okay, so stretches and range of motion you can kind of combine as far as that first section of exercises that you're going to do, or your rehabilitation stretches. Stretches are more static hold activities. Range of motion are non-static. They're very dynamic, and it's just kind of making sure all of that motion that you need is it's appropriate and it's there at the level that you need it to be. So I'm not going to go through and explain all of these because you'll notice down here at the bottom, I give you really good directions on how to do these. Also remember, whenever you do the assignment, you have to explain to me how you do the exercises. So you don't have to use the exercises that I give you in this PowerPoint, but these are the most common ones that you're going to come in contact with, so you do need to take note of them, and I would be familiar with them, because in the future you're going to have to put together exercise programs for certain individuals. You'll do that in your prescription class, and this is just going to give you a good base of support to stand on. The other thing I want you to note is you may notice that you recognize the exercise as far as the instruction down here, but you've never heard of this term. Okay, so these are the terms that I use. A lot of PTs will utilize different terms. A lot of athletic trainers may utilize different terms. It all just comes back to where you learned it. So just be familiar with the multiple terminologies that you might come in contact with for some of these different stretches and exercises. Okay. So for your stretches, we've got your seated hamstring stretch, your lower trunk rotation stretch. Both are pictured there with excellent how-tos below that. And then you also have your figure 4 or your piriformis stretch and your single kneaded chest stretch. The last one is your child pose stretch. Okay. So there's 5 different options there that you can utilize. For range of motion, a lot of this gets to pelvic stability, core stability, because we know that the lower back is part of the core musculature. So looking at that, just know that there's going to be some overlap between the stretches and strengthening exercises as far as utilizing them for range of motion. It's just instead of holding it for a static stretch to indicate that it would be a rehabilitative stretch, you can do a very dynamic action with it. So then it falls into the category of range of motion and even strengthening, strength training at that point. So overall with strength exercises, you always want to progress from an isometric to a concentric to an eccentric aspect of exercise. Once they have appropriate muscular firing patterns, appropriate muscular action, then you can get into, okay, let's progress from to balance and proprioceptive exercises. Okay, so hopefully you know that proprioception is your body's understanding of where it is in space. So if you point to a dot on the opposing wall, you know where it is. You close your eyes, you make your hand go in a big circle, and you need to return to that point. Your body should have the ability to return to that point because it should know where that dot is on the wall, and your arms should be able to line up with it because you are familiar with where it is in space. Okay. Sometimes after injury, athletes lose that ability, so that's something that we need to retrain in the rehabilitative process. Once you get that, you can move on to your multiplanar exercises. So those are your more dynamic exercises. They are a lot harder to do. And then getting into your plyometric activity, which is your quick concentric, eccentric, ballistic action exercises. So for strength training, you've got your pelvic tilt and your cat camel. These are excellent for early onset low back pain rehab. It's really going to get the pelvis moving appropriately because a lot of times people do not move their pelvis appropriately, and because of that they put a lot of stress on their lower back. Because of that they don't use their abdominal musculature of the core. So both pelvic tilt and cat camel are an excellent place to start. Quadruped, I give you all 3 levels here. So first level is going to be just the arms, second level is just the legs, and then the third level is a lot more dynamic where you're using opposite arm, opposite leg. It's a very difficult skill to do and keep that back from arching or the hip from dropping. So you can't list quadruped level 1 through 3 as 3 different exercises on the assignment, so don't do it. You can tell me quadrupeds level 1 through 3, but it's only going to count as 1 exercise, so make sure you don't do that. Then you also have bridges and planks. So these are just 5 options for you here. Again, you can utilize other exercises, but when I'm designing a program, these are the 5 that I'm definitely going to be using because they are the best, and they're not super difficult exercises to do, but you have to have appropriate biomechanics to do these exercises properly. So, again, you have access to that PowerPoint, and then you do need to handwrite all of your answers on this assignment. So if there are any questions, please feel free to email me, and this assignment will be due on Tuesday the 21st when you turn everything else in. All right, so good luck.